familiar with that name, maybe that's a little bit more familiar. Johnson's is quite a familiar name. So very proud to be from Fort Erie. The other piece I should note is I used to work at Hotel du Shaver, and I moved over to Niagara Health because I learned that they were building a new hospital for South Niagara, and that included building a hospital for my family and friends. And that was really important, and I wanted to be a part of that. And a position opened up for communications and jumped right on it. So how I'm going to go through this presentation is I'll talk about the new hospital first, the South Niagara Hospital, and then I'll talk a little bit about Fort Erie, Port Colborne, Welland, and Wainfleet plans. And then if there's any questions, you can stop me or wait till the end. I'm like a true Fort Erie girl. We can stop. We can do whatever you like. We'll free it. So I'm, if someone could allow me to share my screen, I can start the presentation. Perfect.
Sorry, yeah, you should be able to share your screen now.
Wonderful, and you should now see it. Perfect. All right. So maybe I should give you a little bit of context first. So when we built the St. Catharines site in 2013, Niagara Health started shifting the way that it delivered healthcare. So we are taking a different approach to healthcare in that we're taking a regional approach. We're working on centralizing services, so those high expert services that you find in hospitals, and expand access to local healthcare in communities across Niagara. So the picture that you see here is very important because Niagara Health is only part of the healthcare system, and we have a lot of partners that assist in helping us along the way. So that's your primary care, your family health teams, we have mental health and addictions, community care, there's Hospice Niagara. So really, there's an emphasis on it takes all of us to really fulfill the work that in terms of having expert care in Niagara. So we're taking a very much a regional approach to the way that we deliver care now and then going into the future. So when we were planning to build a new hospital in South Niagara, we did a lot of engagement in terms of what that looked like. And we started with the goals and we asked our community and our staff and physicians sort of what our priorities would be in this new hospital. And we came up with 6 building blocks, so to say, hence why we use sort of the fun Lego theme to describe those, starting with patient, family, staff experience, connectedness, so that meaning both inside the hospital and also with our healthcare partners and across the region, operational excellence, accessibility, inclusiveness, environmental leadership, and then to be adaptable, flexible, and responsive, because as I'm sure you all know, healthcare changes at a very rapid pace. So I'm going to get into the technical pieces just for a bit. We're following the Ministry of Health capital planning process. So a lot of people are always confused, you know, why it takes 10 to 15 years to build a hospital. And there's a lot, it's a very complex process. So it's a 5-stage process. We're just going into stage 3 of the planning. And right now what we're doing is we're including the community, we're including our staff and physicians to really get the specifics of the design of the new hospital. So where will the departments be adjacent to, the flow, how big each department will be, and then some of those operational pieces. So we're at a really key aspect in the planning. And I can tell you, so we brought in consultants on in May of last year. And in terms of those meetings and workshops, we've done over 550 hours of meetings so far. I'm just getting a little bit of feedback.
Laura,
make sure.
Everyone else is muted. It's got to be you. You've got 2 personas here. Please pick one.
So I'll move on to the fun stuff. So Oh, I'm still getting. So the location at Bigger Road and Montrose Road. So close to Yogi Bear Park. If you can picture the most, there's no real landmarks in that area, so I always say that it's close to there. It's on the way to Welland, so that major intersection. We are right across from the Heritage Hall as well, if you're familiar with that area. So it is 50 acres. So to give you an idea into comparison, if you've ever been to the St. Catharines site, it's a little bit larger in terms of the space. It is a greenfield site right now. And so much like the St. Catharines site, we are presuming that the area around that site will grow quite tremendously. So we've been working with the City of Niagara Falls and the region very closely to make sure that we develop that area properly. And that's from roadways to transit systems. So there's a lot included in developing a new hospital, and we pride ourselves on working very closely with all of those partners. But that area will change quite drastically when it's opened. So this is a preliminary campus plan to show you sort of what we're planning so far. We're proposing an 11-story building at this point, and I should just note that this is a conceptual and illustrative plan. What happens when we bring a project company who will actually build the hospital on board? It may change the layout and the look of the hospital slightly from our plans, so we want to do a conceptual illustration first, just to demonstrate what we're thinking that it will look like. The reason that we're proposing an 11-story building is for a couple of reasons. One of the main reasons is that we're really building this hospital for the purpose of and keeping seniors in mind. So we always go back to lessons learned from the St. Catharines site. Oftentimes there's a long way to travel from parking. There's also once you get inside the hospital, it's a long way to get to an elevator or to some of the programs and services. So by building a more vertical hospital, it's actually better for patient experience and easier wayfinding. So very much focusing this hospital on seniors and their needs. It's going to be approximately 1.2 million square feet. So then again, that's larger than St. Catharines. The St. Catharines Hospital is just under 1 million square feet, just to give you some context. And we are proposing a transit hub on site. And I know that Lauren and I talked about this very briefly because one of the concerns for Fort Erie and Port Colborne is the access to services in there. So this is where we'll work with the city and the region to make sure that there is a transit hub, not only for our staff and physicians, but to make sure that people can actually access the hospital if they don't have a vehicle of their own. So the South Niagara site will serve over 50% of Niagara's population. So the service area is Niagara Falls, Fort Erie, Port Colborne, Wainfleet, Welland, and Pelham. We also have centers of excellence, which I'm going to go over in a minute. Those centers of excellence are essentially, we're bringing together expert care in one area. So much like if you're familiar with the St. Catharines Hospital, the St. Catharines Hospital has the Walker Family Cancer Center, cardiac, and then women and babies. Those are their centers of excellence. And ours will have a few different, which I'll go into the same. Those centers of excellence will serve the entire Niagara region. So if you need care in stroke from all across the region, you will go to this hospital because it will have that expert care. And again, I mentioned design with the senior focus embedded into all aspects. One of the other really neat pieces is that we're working towards WELL certification. So many of you may be, if you've been in facility or building construction, you're probably familiar with LEED, and that looks at sort of the actual construction of the hospital. WELL certification is looking at how we're building the hospital and how it affects the people in which are in the hospital. So we look at air quality, water, is there enough drinking areas, nourishment, are we providing good food to our staff and our patients, is there enough light for everyone, the movement, thermal comfort, the sound, and then are we bringing in community into that space. If we are successful, we will be the first healthcare facility certified in WELL in Canada. And so that is huge for a couple reasons. First of all, we really want to attract and retain employees and make sure that we're bringing in those top skilled people into Niagara to care for everyone in the South. And the other really great piece is just for our staff and physicians. So they'll have a lot more access to light, they'll have a lot more access to gardens, to be outside, and overall will just be better for their well-being. So this is one piece that we're very proud of moving forward. To give you an idea on the programs and services, typical for a very large acute care hospital in terms of emergency medicine, critical care. The interesting piece to this one is that we will have Indigenous healing at this hospital. One of the pieces that we learned from doing engagement is that many of our Indigenous feel marginalized and not comfortable in going to the hospital. And so in terms of working with them, they actually have a dedicated space, which will be right inside the main entrance to the hospital. And they have their own healing garden. And of course, not just used for our Indigenous partners, but for all who enter the building. And hopefully through this, we'll really encourage them to get the right care that they need at the right time. So we're very, very proud of that partnership, and we have some really great stakeholders around the table providing us with some interesting pieces that will be included in that. So that's a really important piece for Niagara Health. And then this is the part where I want to talk about the centers of excellence. So really focusing on geriatric care, complex care. So we'll have centers of excellence in complex care for the region. Stroke is a huge one. So if you're familiar with the Niagara Falls Hospital, currently stroke, we do have a regional stroke center. We'll be expanding the services in stroke to provide even more enhanced care. And then wellness and aging. We've identified that Niagara has a very high population of seniors, and we want to make sure that we're prepared to care for them and moving forward. So I just want to stop here and see if there's any questions on this, because I've been running through it and I've been giving you a lot of information on the hospital so far.
Yes, had to find my microphone. Couple things in the WELL certification.
Mm-hmm.
You said water, and it's really funny because when you go to St. Catherine's Hospital, you're hard pressed to ever find a drinking fountain there, and I'm always thirsty, and I'm wandering all through the halls, and there's no drinking fountains anywhere that I could find. And I'll be darned if I'm going to go into the bathroom and use my hands to drink water. It's just, that's silly. So anyway, that's something that's nice that you guys are looking into that.
That's a great point. So I will note the interesting thing about Niagara Health and the way that we're extremely fortunate is most other healthcare systems across Ontario haven't had the opportunity to build 2 hospitals in their area. They build one for sort of large stream areas such as Toronto. We're in our second major infrastructure build. So within a span of 10 to 15 years, we have and we have the same staff that worked on the St. Catherine's Hospital. So there's a lot of lessons learned, and we're definitely putting those pieces into this new hospital. So in that respect, we're extremely fortunate to have that knowledge and to have that background.
It must be very difficult